Hello friends, I'm Dr. Swati Kanakia, a Pediatric Hematologist Oncologist from Mumbai. 8th of May every year is marked as the International Thalassemia Day. This year's theme is Strengthening Education to Bridge the Thalassemia Care Gap. This series of videos, Living with Thalassemia, is for patients and their parents and their family members. We are sure that this information will help all of you to take informed decisions regarding your treatment. One very important aspect of managing or living with thalassemia is blood transfusions. There are a lot of queries that come up regarding blood transfusions, and some of my patients would ask me that, Doctor, what is the meaning of leucoreduced blood? So let us see. What is leucoreduction? As the name suggests, leuco and reduction. That means removing leukocytes or the white blood cells from blood is called as leucoreduction. Why should blood be depleted or leukodepleted, or why should the blood that you receive be free of WBCs? The reason is that each unit of blood contains around 10 raised to the power of 9 WBCs. These actually have no therapeutic effect. That means they are not useful for treatment, but they have a very big they are a very big reason for side effects. Okay, these WBCs, we also call them as passenger WBCs, and the aim of the entire process of leucodepletion is to remove 99.9% WBCs, that is to achieve around 10 raised to the power of 6 WBCs per unit. So what are the side effects that the WBCs in blood can cause? You're all aware of fever, which you'll get, or some of you might get after starting a transfusion. It's a very common problem. So, one of the reasons for this fever is the WBCs, the passenger WBCs in the unit of blood that you get. They're called as the febrile non-hemolytic transfusion reactions. Also, certain infections like CMV, the variant Creutzfeldt-Jakob disease, prion diseases, bacterial contamination, uh, refractoriness to platelets. Of course, it's not applicable to thalassemia. Transfusion associated GVHD and transfusion associated immunomodulation. All these are side effects which can be caused by WBCs. So, when is leukoreduction done? As in, when is this process carried out? So, as the name, it's basically a filter, okay, which is attached to the blood unit, okay. A lot of you all have used WBC filters in the past. This was attached to the unit of blood, and the blood actually was filtered by the filter, the RBC filter, and then was given to the patient. So, this was called as the bedside filtration. The other way of removing WBCs is to attach an inline filter. What does this do? There are two ways. One is, as soon as the blood is being collected from a donor, it passes through this filter and is then collected, or otherwise, this entire assembly is taken to the blood bank, and the filtration process or the depletion process is carried out in the laboratory or in the blood bank. So, one is bedside filtration, and the other one is pre-storage filtration. Pre-storage could be either in the blood bank or in the laboratory, or otherwise it could be at the bedside, at the site of collection of blood. So, which is better? Is the leukoreduction which is carried out at the bedside better, or is it better in the pre-storage, during the pre-storage phase? So there are studies and there is consensus which says that pre-storage leukoreduction is better in all those aspects that we just discussed, whether it was a lowered incidence of the febrile non-hemolytic transfusion reactions, alloimmunization, transmission of infections, and even better than that is that each and every unit can be proper quality controlled. Okay, so that is why we prefer pre-storage versus bedside leukoreduction, and now this is available in India. Friends, thank you for watching this video on leukoreduction. I hope it was useful. I hope that it answered some of the queries that you might have had, when you go for transfusion. If you have any friends or family members or loved ones who could benefit from this video, please feel free to share it. This is an educational initiative by our clinic, that is the Blood and Cancer Clinic, Kanakia Healthcare. We wish to make complex medical knowledge available to patients and their families so that they can really share uh, in the decision making with their doctors. Also, friends, I must tell you that this video cannot replace a consultation with your doctor or hematologist or blood bank. So please contact them at all times. Thank you so much.